Well, scientists say they are closer to figuring out why some people may be more prone to post-traumatic stress.
In your health link, researchers identified 2 genes that they say may play a role in developing PTSD. They hope the findings will help diagnose and treat the disease better in the future.
A new study finds that more than 10% of patients who are being prescribed aspirin for heart disease prevention should not be taking that medicine.
Bigad Shaban explains why the medication can be harmful to some patients.
57-year-old Brian Hull has high cholesterol and a family history of heart disease. He takes low-dose aspirin every day to reduce his chances of having a heart attack.
The concern was that I not have a heart attack like my father did.
A new study finds more than 10% of patients taking aspirin to prevent a first-time heart attack or stroke should not be taking the drug. Dr. Ravi Dave is a cardiologist at UCLA.
You can have a risk of having bleeding in your stomach. You can even have a certain type of stroke that can cause you to have bleeding inside your brain.
Researchers from Baylor College of Medicine in Houston looked at 68,000 patients and calculated each one's risk of developing heart disease over the next decade. It's based on factors such as age, sex, and blood pressure. Researchers found patients whose risk is considered low should not use the drug.
You need to check with your doctor to see if you need to continue taking the aspirin.
The study also found 17% of women were taking aspirin unnecessarily, compared to 5% of men. Brian Hull believes using aspirin over the past 10 years has prevented him from having a heart attack.
Knock on wood, I haven't had one yet, and I'm hoping I won't have one for forever.
Bigad Shaban, CBS News, Santa Monica, California.